Hello.
Hi,
Hi, Jyoti.
good
Hello
afternoon.
and
How are you?
good afternoon. I'm good. Hope you are very well too.
As well, yes, thank you.
Great. So, hello and a very warm welcome to all our listeners. Thank you for joining us today. This is Alpa Zaveri and we have Jyoti Devjani with us. Hi, Jyoti. The topic of today's session is baby massage for preterms and special need babies. So let's find out if the massage for preterms and special need babies is any different from a normal full-term baby. And if yes, how is it different? We have the best person who can answer these questions, which is Jyoti. So besides being a certified massage therapist, a certified pediatric massage therapist, and a certified infant massage instructor, Jyoti has also done her certification in massage for special needs children. So, Jyoti, please help us understand, should babies born preterm be massaged?
Uh, so let's think about this. In utero, constantly the baby's nourished, held firmly in the womb. They are hearing the sounds and muffled sounds. The lights are dimmed. Their fragile skin is protected by fluid, and their lungs and brain can steadily prepare for independent life. By
Hmm.
contrast, for a baby who's born premature, they are now transited into a very stressful environment in the world where the lights are bright, there's harsh sounds in the neonatal ICUs, and
Right.
there is separation from the mother, from that environment, and often they are painful and invasive procedures. So,
Yes.
yes, preterm babies have been shown to have a more limited response to touch because of these factors, because they are experiences in a very different form of touch and very different form of stimulation. However,
Right.
if premature babies are given lots of skin to skin and nurturing touch from parents and other care providers, they are able to develop a more normal response to touch over time. And in fact, by holding our babies close to us who are born prematurely, we are able to mimic the conditions closest to that of back in the uterus. So,
Right.
studies show that premature babies put on more weight when they get appropriate nurturing touch. They can leave the hospital earlier, so the hospitalization time is reduced. It
Hmm.
aids in babies' brain development, promotes their sleep, which is very necessary for babies born prematurely. They really need their sleep. It
Right.
boosts their immune system and circulation. It helps to regulate their heartbeat, blood sugar, blood pressure, oxygen saturation, breathing. So all of that is regulated. So therefore, their digestive system works better. They gain weight better. Um,
Hmm.
and it also helps with breastfeeding. Breastfeeding usually starts more easily if they are provided with skin to skin and nurturing touch.
Right.
More breast milk is produced, feeds
Hmm.
are more frequent, and there is better digestion. Also, for parents, when they are able to get this skin to skin or touch with the baby, they are also able to better understand their baby. They themselves get a feeling of being more empowered, confident, and more relaxed and stress free. So, yes, there are a lot of benefits for us
Right.
to touch our babies who are born prematurely at an appropriate time and an appropriate way.
Right. Right. So that brings me to my next question. Having established so far that massaging a preterm, a baby born prematurely, could be beneficial in more than one ways for the parent as well as for the baby. But what's the right approach? How should uh, preterm baby should be touched? What is the approach to be followed over here?
Okay. At times, people, parents in our classes say, my mom-in-law told me. This is a real example. Somebody's mother-in-law told them, because the baby was born prematurely, that you have to massage your baby every day as strongly as possible, at least 3 times a day, so that they can catch up with their growth and development.
Okay.
While it may sound logical, that because we understand that, oh, baby massage is good for growth and development, so the more we do, the better it is. And while it may be tempting to massage a baby born preterm more, it may not necessarily be the best for the baby. Now, let's
Okay.
try to figure out what are the baby's goals. Right now, when the baby is born prematurely, sleep is of importance. It's of paramount importance for their growth and sensory development and for their brain development. So babies are not able to spare the energy to take in other stimulation. Taking in stimulation also requires energy by the baby, whereas the baby needs time to sleep and grow. So they only have brief opportunities and little energy to receive the extra stimulation. They can get easily overstimulated. So
Right.
their skin is even more delicate, their systems are even less mature than a full-term baby, and we should understand they become overstimulated more easily. Therefore, we need to touch them and massage them when they have reached a certain amount of medical stability, and we need to keep adapting to their growth and development.
Right.
Having said that, now let's talk about what can be some considerations.
Yeah.
Okay, let me just also, so check in with the doctor if the baby is able to tolerate touch or take in the stimulation that we want to give. Talk to the doctors about what is best suited for your baby. And
Okay.
remember, touch can take many forms. It's not necessary to just massage them. In very young babies and babies born preterm, just placing our hands lovingly, gently, holding them, giving them skin to skin, breastfeeding are all a form of providing nurturing touch. Of
Correct.
course, massage is a way of touch, and also there is something called pre-touch, where we are not actually placing our hands on the baby's body, but keeping our hands a little away from the baby's body, conveying our intent and energy by just being in their proximity. Of course, the sooner a baby can receive all of this, the better it is for them. But we need to check that this does not get in way of any medical interventions, and we have the doctor's clearance to do this.
Correct.
Uh, then other considerations and adaptations are that parents with babies born prematurely may start the baby massage once the baby is at an adjusted age, which means once they are at the what they would be if they were born full term. Once they reach 3 to 4 weeks of that age, and if
Okay.
cleared by the doctor, start your actual massage. Before
Right.
that, do the pre-touch, do the touch, do the skin to skin, do the breastfeeding, etc. Uh,
Okay.
the massage should be moderate pressure and for very short durations of time, maybe 5 minutes or so. Again, remember, it should be moderate pressure, not feather light, because they are contradicting views that people just give uh, without understanding. Sometimes we are
Yeah.
told use lot of pressure so that their bones become stronger. Please don't do
Yeah.
that. We don't need excessive pressure. Other times, other people tell us, because the baby is born prematurely, use feather light touch because they are very delicate. Even feather light touch will overstimulate them and feel very uncomfortable to their delicate skin. So we need to adopt moderate pressure for a short period of time, not long massages. We should be aware that the baby might react to a particular stroke or body part due to their previous experiences of negative touch. For example, if certain medical procedures have taken place on their foot, etc., they may have an adverse response to that area being touched. We parents should adjust to baby's corrected age, that is, how old baby would be if born on the due date, right?
Right,
And
right,
consider the positioning. The baby should be well nested, cocooned in a cradle position so that the baby feels in balance and their body feels organized. Um,
right,
we need to keep it simple and led by the baby. We don't need to show the the whole array of techniques and strokes we know. We just need to provide them the comforting touch and tactile stimulation that is required by them. And parents should trust themselves and the power they have to positively impact their baby. Babies very easily recognize the love and energy that flows from their parents' hands. So that's the most important part. Also, keep in mind that some babies may not be able to tolerate massage strokes for medical or developmental reasons. So, parents
okay,
should not feel um, disheartened by that. Check in with an occupational therapist or with someone who has experience in this field on what should be your approach. Remember,
right,
the massage routine has to be guided by the child's needs and their ability to integrate the stimulation to their senses.
right,
And the parent also has to be ready and in a state of mind to be able to focus on something like this, because many times situations like this are very challenging for parents as well. It is very overwhelming. It is very sad for parents when they are going through such situations. So parents themselves should be emotionally ready to be able to positively focus on something like that. And also talk to the child's medical team and make sure that what we are doing is in the child's best interest. So these are some of the considerations and adaptations that one should keep in mind.
great. That was very insightful, Jyoti. And my next question, I think in a way you have already answered, but anyway, I'll just touch upon that again. How much touch or massage to provide? So, as you mentioned, it cannot be a very long massage, but would you like to answer this question briefly again? How much touch or massage to provide?
Yes, Alpa, because we say short duration of times, and we also ask the parents to look at how the child is responding or how a baby is
Yes,
responding. Now
yes.
parents feel that how can my baby tell me that they are done, you know
Hmm. Yeah.
we need to understand that while touch will benefit our baby, we need to look for signs of overstimulation. So, like I mentioned earlier, babies can only take a certain amount of stimulation, especially babies who are born prematurely. So, they also give out cues, signs with their bodies. Um, and we need to be we should be observing them so that we can tell these signs. They may give us
Okay.
signs that indicate overstimulation, stress, fatigue, or that they are overwhelmed or tired and they need time. So,
Right.
we call them avoidance cues, and they may appear together in clusters. For
Yeah.
example, it may be a repetition of a single cue. Um, Say a baby yawns 3 times. That's a repetition of a single avoidance cue, and the parent, if only if the parents are aware of it, will they be understand, okay, now my baby needs a break from what we are doing. So I'll
Right.
just mention a few avoidance cues. Not possible to
Mm-hmm.
mention everything here. So if
Hmm.
we notice that the baby's breathing has changed, like sudden change in the baby's breathing rate, it's become much faster, or it's become irregular or slower, or the nostrils are flaring, that's one cue. Or if the color is changing suddenly, or the heartbeat is changing, or if there are some digestive indications, like the baby is starting to gag or cough or spit up or vomit or hiccup,
Hmm.
or certain other cues like twitching, startling, tremors, sneezing, yawning.
Yeah.
So there are many cues like that that the babies give out, which it would be great if parents with babies who are born preterm can look into them when they are interacting, so that they can understand their babies better, and therefore
Right.
appropriately provide them what they need.
Correct. Correct.
So when we start seeing these avoidance cues, that means that's the time for us to stop what we are doing, reduce the stimulation, stop the stimulation, and just let the baby be and rest.
Correct. Correct. So even during our classes, many mothers come and share this with us, that they heard from someone that if a baby is born preterm, they should be massaged as soon as possible and as much as possible, so that they can catch up with growth and development. So just clarifying over here that this is a myth and it is not backed by any scientific evidence. So this is not recommended. And moving on to massage for special need children. So, is massage helpful for children with other special needs as well? And what are the considerations in this case?
Just as the benefits are of massage for um, babies born preterm or full term. Similarly, there are benefits for children with special needs as well. That is when a child has some level of physical, adaptive, cognitive, social, emotional, or communication developmental delay, which may require additional support.
Hmm.
So this infant massage allows for an opportunities for parents to focus on and communicate and deepen their relationship with their child. However, we should remember that infant massage does not replace any therapy or treatment from their doctors. Um, so,
Right.
so it's important to remember that it is very helpful. There are many benefits of this, and it helps the parents of such children also to communicate and understand and provide for their children in a better way. For example, there are children who may be on certain ADHD spectrum or autism, etc., and they will benefit. But we are ending our session here. I will just say this: one massage does not fit all. Different situations call for different type of touch. Some children are better able to take touch, some are not.
Thank you for watching. For more such videos, do like, share, and subscribe to the First Parents.